Welcome everyone, and as you log on, feel free to answer our poll. Again, just trying to get an idea of how diabetes affects you and your family. If you're a caregiver or if you have a diagnosis. I know most of us probably know someone who has dealt with or is dealing with diabetes, so very, very common. Okay. Looks like right now most of us joining care for someone, so that was the intention of our program, so wonderful. I'm just going to introduce myself. My name's Chris Jelfs. I'm a nutrition and wellness educator with Extension. I cover the Southern Illinois area, Madison, Monroe, and St. Clair counties. So, as well as we do work across the state with my cohort here is Caitlin, as well as 8 other nutrition and wellness educators. I teach a lot of community classes, a variety of age groups from youth to adults, and I love being able to teach the different topics such as food safety, chronic disease prevention, and teen health is some of my big areas. So love doing that. I have 2 very active teenage athletes, so that's near and dear to my heart as well. I will be your moderator today, and Caitlin will actually be our presenter. Caitlin is also a nutrition and wellness educator and registered dietitian with Extension. She serves DeWitt, Macon, and Piatt counties in the central part of the state. She also teaches community classes and offers professional development related to chronic disease, food safety, and food preservation. So we would like to welcome you again today. If you have any questions, feel free to put those in the chat box as we go along, and you can see our emails there too if you have future questions as well. So just a little bit about the University of Illinois Extension. We are a flagship outreach effort of the University of Illinois Urbana-Champaign. We are a land-grant university and offer evidence-based educational programs to residents of Illinois in all 102 counties and beyond. And again, if you are looking for local programming in your area, please visit our website at extension.illinois.edu, as well as you can follow along on our Facebook page. And with that, I think we are ready to get into our program with Caitlin.
Thanks, Chris. I am going to turn my camera off. I know we talked about just for bandwidth. We wanted to have our faces very briefly to introduce us, and then we're going to turn off our cameras just to save some bandwidth. So I'm going to do that here, stopping my video. There we go. All right. So welcome to the, oh my gosh, welcome to our 3-part training, Taking Care of Diabetes Together. This is a series designed for caregivers with those with diabetes, particularly those that have a disability. And so today and then the next 2 Thursdays, we will be covering more topics around diabetes, nutrition, eating, physical activity, using glucose monitors, different topics around this for training. For those of you that are interested in continuing credits, we did finally secure, I'm very pleased with that, for our professionals that work for folks with disabilities. So that information will be coming out later as we get going. So we're going to kick off today looking at a little bit of background. So there's lots of different studies out there. I like this graphic from one of these studies to show that probably, as many of you may already know, especially for those of you that work with individuals with disabilities, diabetes rates are higher in individuals with any disability. And so in this study, they broke down, was it a disability around eyesight or hearing, mobility, cognition, disabilities around self-care or communication. And as you can see on these charts, right, the more severe the disability, the more likely it is that that person had diabetes. And so this is about, on average, about, 10 to 20% of adults with any disability have diabetes. And so with this series particularly, we are working to educate our caregivers that work with adults with developmental and intellectual disabilities. But as you know, I'm sure many of our audience know that adults have a lot of disabilities in addition, maybe to other disabilities that they have. So it's not just usually one disability, they may have multiple. So this first session is going to be a primer for what is diabetes, how are we learning, and what do people do with this diagnosis? So diabetes is marked by higher than normal blood sugar. We also call this blood glucose. So when we eat food, carbohydrates are digested into their smallest part, which is called glucose. It is just a type of sugar. That glucose moves from our digestive system into the blood, and from the blood will get moved around the body. As the heart pumps, we move that blood around, and the blood sugar will go with it. So if you've ever heard the term blood glucose or blood sugar, I will probably use those interchangeably as we talk today. So as that blood is circulating around the body, it's taking that sugar with it. And then as that blood gets next to different body cells, those body cells will absorb that sugar and use that sugar as fuel or energy for that body cell. So cells in the heart and cells in the muscles of the legs and the muscles of our face, they're all using sugar as a source of energy to fuel all the things that cell needs to do. As a result of those body cells absorbing sugar, that means that the sugar in our blood has to drop. And so we look at a range, right? As we're eating, we may have higher blood sugar than at fasting. So we know that is possible. We also have instances where we can have really low blood sugar. And so we're going to talk about this range, like what is normal with diabetes with blood sugar. So for most people with diabetes, they get that diagnosis because there's more sugar in the blood. We call this hyperglycemia. And so this is, so we'll talk about how to get diagnosed with this. And then on the other hand, we'll talk about hypoglycemia, which is low blood sugar. So we'll come back to that. As we eat food, this is where our blood sugar starts to rise. So as we're eating, a lot of us maybe probably just finished lunch, and so our blood sugars are rising because we've had food. And then as we finish eating, our blood sugars will eventually kind of plateau. They'll get to a high point, and then our body will start to use that sugar, that glucose, for energy. And over time, our blood sugar is going to drop again. And as that blood sugar starts to drop, it might be a couple hours later where we start to notice different hunger cues, right? Your stomach might start to gurgle. For me, I tend to notice that I get a little headache or a little pain, between my eyes. And I'm just kind of interested, like, oh, food sounds really good right now. And so I have some food, and this starts the cycle all over again, where my blood sugar again is going to start to rise. I get to a point where I feel full and I'm not hungry anymore, so I stop eating, and my blood sugar will rise to a plateau. And then my body cells are going to start using that energy, and my blood sugar is going to drop again. And we just continue the cycle over and over. For people with diabetes, that hyperglycemia, their blood sugar is just starting at a higher point. It's going to peak at a higher point, but it's also not going to typically drop as low. And so this is where, for someone with prediabetes or with diabetes, their sugars in their blood are just staying higher. And this leads to some different health consequences that we're going to talk about later. So let me introduce you to this graphic here. So we've got a kind of body cell in yellow. We've got what we call a glucose channel in green on the right side. And we've got an insulin receptor on the cell in kind of a blue-purple color on the left. And so for glucose to get inside our body cells to be used as energy, we need a hormone called insulin. And insulin has to get in the right spot and bind to that insulin receptor, and acts kind of as a lock and a key to open the door of our glucose channel. So currently we have glucose on the outside of the cell. Insulin is not in place, so that glucose channel remains closed, and so the glucose has to stay in the blood. It's not able to get into the body cell right now. But when insulin is in place and it binds to that insulin receptor, I kind of think of it, like a door opening, right? Like you walk towards a hotel or a Target or another shop, and those doors kind of open sideways. Uh, that allows for glucose to get inside of the cell now. So we have insulin in place, that glucose channel gets to open, and the sugar gets to come inside the body cells to do all the good things that that cell needs to have for energy. So without that insulin, that glucose tends to stay in the blood, and it's really, really hard to, well, it would be impossible, right, to get that glucose into the cell. So diabetes is not just one condition, although all of these types of diabetes are marked by higher than normal blood sugar, but the mechanisms can be a little different. So with type 1 diabetes, this occurs in people who are not getting any insulin produced by their pancreas. So they are not able to produce that insulin, and so their blood sugars remain high because the insulin is just not present. In type 2 diabetes, we have insulin, the pancreas is producing insulin, but it's not being used properly. We're not sure at this point in research why exactly insulin is not working as properly, but we do know risk factors that show that at what we call insulin resistance. So your cells are resistant for some reason to that insulin. And we're still learning why that happens, but we do know risk factors of carrying excess weight, not being physically active, different food choices and medications, other hormones that are not insulin may be involved in this, as well as genetics and family history. For gestational diabetes, this is occurring with higher than normal blood sugars while a person is pregnant. So growing that baby, there's a lot of things going on, and in some cases, those moms will have higher than normal blood sugar. Fortunately, for most moms, that will resolve itself. They will go back to normal insulin, or excuse me, normal blood sugar metabolism after they give birth, but it does raise their risk for the future that they might develop diabetes with that after that pregnancy. Pre-diabetes, as kind of the name might suggest, is higher than normal blood sugar, but not quite high enough to be diagnosed as diabetes. Although it is a risk factor in developing diabetes in the future. So there's lots of programs out there to help people identify how's your blood sugar doing? And if it is in that pre-diabetic range, we can have some education and supports to help you lower that. There are other types of diabetes that are less common. They can be caused by genetic mutations, autoimmune disorders, or be a part of other health conditions. So like cystic fibrosis is one condition where it's very common to also have coexisting diabetes. Might also be the outcome of something like surgery. So if you had surgery to have your pancreas removed, maybe there was a reason for that removal. That would also mean, right, my pancreas is gone and I can't produce insulin. So that would mean that I'm going to have really high blood sugar unless I'm using medication to help manage that. So here's what we're looking for. So hyperglycemia, so that high blood glucose, high blood sugar. People often find that they notice they're just going to the bathroom a lot. They're finding a toilet, they're having increased urination. And kind of as a result of that, they tend to be more thirsty, right? The body is using the kidneys to help filter out that extra blood sugar in the blood. And that is one way the body can remove that extra sugar is through urination. Well, that also, along with just going to the bathroom more frequently, is pulling a lot of water from the body to dilute that sugar so you have enough urine to urinate out. So you might find that you're extra thirsty. You might also notice that you're really, really hungry and really, really tired. This can be basically your cells are not getting energy. And so you are essentially kind of starving with not having enough sugar in your body. You might be eating, but your cells are not able to use that energy that's available. Some people find that their vision gets a little blurry, like they have to kind of blink a few times and try and focus, and it may or may not stabilize right. Maybe you can't focus quite right. This can be a result of just more sugar in the blood and those really, really tiny vessels. So you think about all the, little tiny vessels of the eyes or like the fingertips, or even like the toes, those really, really tiny spaces in the body where sugar is probably going to be damaging those vessels. And so you may, one symptom can be that blurred vision. Some people find that they get frequent infections. This is, that result of increased urination. They may find they get more urinary tract infections, for example, or if they get a cut on maybe they're, a paper cut or, another injury to their skin. It may take a while to heal, or maybe it feels like it might get infected because we do have bacteria on the skin that can sometimes lead to infection. And then a lot of folks do find that they lose weight in this process because, again, the body cells are not getting energy. And so they have to sacrifice other tissues. So you're going to be losing fat and water and maybe some muscle mass with this because the body cells just aren't able to get that. We did have some folks share in the poll about them being on this call today, and you have a diagnosis of diabetes. And then for our caregivers, if you're comfortable sharing, what of these symptoms did you maybe experience yourself? Again, only if you're comfortable sharing, but if you were a person diagnosed, what were those symptoms that you noticed? Or if you were a caregiver, how did you notice that maybe the person you were caring for had some symptoms that may have been diabetes? And so while folks are sharing, we're going to go actually to the other side of the coin, which is hypo or low blood sugar. So these are not all of the signs and symptoms of a low blood sugar, but definitely teaching yourself. So congratulations for teaching yourself today. You're going to learn more about this, as well as your person that you're caring for, to recognize what a low might look like. So if your person that you're caring for, or a person with diabetes, if they're able to test their blood sugar, what we notice is that these symptoms of low blood sugar start around 70 milligrams per deciliter. And what people tend to physically notice is that they might start getting really hot. They might start sweating. They may feel kind of like shaky or feel very anxious, like something feels wrong. They may say that they're hungry. Their heartbeat might feel a little off. It might feel too fast, or it might just feel like it's not beating correctly. Some people say that they feel dizzy. And then kind of the worst direction of this would be losing consciousness. Right? If your blood sugar drops so low, your body can't maintain function. It will can cause you to go unconscious. So often our lows are kind of a mix. So it may be from just not eating enough food, right? If we're not giving the body energy, our bodies don't have enough sugar to even just keep our blood sugar high enough. And so not eating can be a result. Also, if you are on medication and you're not eating, the medication is going to lower your blood sugar. But if you're not eating in tandem, that can cause extra lows. And then some of just the oral medications and even insulin can cause these lows. As someone who does not have diabetes but has experienced hypoglycemia for lows before, I can commiserate with anyone on the call who's also had this. It's really scary. It's not fun. So, we do our best to make sure that we are eating regularly and we are taking medication appropriately. Chris, I'm going to turn back to you. Is there anything in the chat that you want to share?
Let's see. So we have the common symptoms of the hyperglycemia. A lot of times people have different symptoms. And then the hypo. I had a question, are these signs of type 1 or type 2? And they're signs of both, either one, type 1 or 2, can cause these symptoms. One said her daughter was sleeping a lot. So again, common symptoms that sometimes you may think things are off, but may need to take a little bit more seriously. And especially if you are caring for individuals, that may not be a diagnosis, but I think it's real important to keep an eye on those hypoglycemia symptoms, especially if individuals are unable to express their needs, but you could tell by their, their actions and their just observations.
Thank you thanks everybody for sharing. I'm looking through the chat box as well. That's great to hear everyone sharing their stories, and we will get to questions. We'll have some time at the end to talk about some questions that I was seeing as I was scrolling. So diabetes, I'm just going to bust a myth here, right? Diabetes is not caused by eating too much sugar. Diet is an important part of this set of risk factors, but it's not eating too much sugar. We'll promise you that. So there are a lot of other reasons. So one is age. So as we age, our body systems just start slowing down. They don't work as efficiently. And so typically, the recommendation is that at age 35, people get tested for diabetes, just as kind of a starting point. Certainly, if they have other risk factors, that we would do testing earlier. We find that people that carry excess body weight, it may change how insulin is used by the body. And so carrying that excess weight may have lead to that insulin resistance, which makes it harder to get that sugar, that glucose into the body cells, and maybe a risk factor for developing diabetes. Of course, family history, if you have a first-degree relative, a parent, a sibling who has diabetes, that raises your personal risk. Rates of diabetes are also higher among persons of color, so African Americans, Native peoples, Latinos. So that is a risk factor to consider. Your own personal history. So if you have a pre-diabetes diagnosis, maybe you had diabetes during your pregnancy, these are all risk factors that might lead to a diabetes diagnosis in the future. Inactivity, so people that are not able to do a lot of physical movement, which can actually help lower blood sugar, is going to make it harder for the body to use that food that you've consumed. And so being physically inactive raises that risk. And then if you have other health conditions, I mentioned like cystic fibrosis often comes with a diabetes diagnosis. Also, polycystic ovarian syndrome, or PCOS, is another one that's commonly found as kind of tag teaming, right? You have one condition and may result in a second, like diabetes. So really all I've said is that there's higher than normal sugar in your blood. So what does that mean? Like, that doesn't sound too awful. Uh, Unfortunately, having high blood sugar for many months or many years starts to lead to damage of other body systems. So up here on the slide, we can talk about the connections between the heart, the kidneys, the eyes, the nerves. I'm going to go through some of these here, but what generally we find is that the higher amounts of sugar in the blood can cause like physical damage. So you just have kind of think of it as a lot of cars on the roads. There's a lot of congestion, a lot of traffic. And if that glucose is really high in the blood goes everywhere, right, in the body. And so it may just kind of like run into things. It runs into body cells. It makes it harder for the blood to do its job. And so we start to see damage to some of these. So cardiovascular disease, right, heart disease. So things like high blood pressure, cardiovascular disease, including heart attack or stroke, which is actually a separate one here. It's a higher risk. If you have diabetes, you're also at higher risk for cardiovascular disease. Same for kidney disease. We talked about the kidneys are often a first line of trying to get rid of that extra sugar. And so the kidneys can get damaged over time because they're trying to filter out a lot of that sugar. We say in some cases, people with diabetes start to have vision changes, or they get eye trouble. And again, this is those really tiny vessels of the eyes. And same for neuropathy, which I'm going to jump to next here, is nerve damage, right? So the nerves of like the finger. So some people with diabetes report that they feel a little tingly in their fingers or their toes. And some of that can be complications from the disease where, again, we're just getting some of that damage, those really tiny vessels. Some people with diabetes find that they get foot complications. Amputations are one of the more common or diabetes, I should say, is one of the more common reasons for a foot amputation. Um, Skin complications we talked about a little bit as well. So if there's more sugar in the blood, bacteria, they love sugar. And so if you have sugar in the blood and you get maybe a cut on your arm or on your foot or another part of the body, it may be harder for the body to heal because there's bacteria that are very happy to start an infection on your skin. With oral health, we find that people may have more gum disease when they have diabetes. They may also experience a little bit more hearing loss as different nerves get damaged. So hearing is a lot of nerve communication between the outer environment and your brain. And so if there's nerves that are damaged in the ear, you may start to notice that you're not hearing quite as well. And then diabetic ketoacidosis is really kind of a really hard really hard experience for diabetics. So what's happening is if the body is not able to use sugar or glucose as energy, it will instead try to use fat. And so it will break down fats to use as energy, which works for a little while, but that breakdown creates what are called ketones. And these are very acidic, and they can change the pH of the blood, which gets very dangerous. The body likes to keep a pH of a very specific range. And so if it goes, lower than that, that can be really, really bad for the body. So if anyone ever loses consciousness and you know that they're diabetic, it might be worth suspecting that they might have DKA, diabetic ketoacidosis, and make sure that they go call an ambulance, check, go to the ER or a hospital. So for those of you that are on the call today and you already have a diagnosis, you might have gotten screened, and we do recommend starting screening if you have symptoms that we've talked about, or around age 35. And if your numbers are normal, the recommendation right now is just every 3 years, get your blood sugar retested just to double check that things are still on course. And if they're not, then we can address that. Your health providers can help address that. Most of the diagnosis for diabetes is going to be based on blood testing. So we're going to look at 3 possible types of tests, and your medical provider may do a combination of these to really diagnose that diabetes, or they might really just focus on 1 or 2. So fasting plasma glucose, a lot of us have probably experienced a fasting blood test. We're asked not to fast for usually a 10 or a 12-hour period. You go get your blood drawn, and they can check for the amount of sugar or glucose in your blood. There's also a test called a hemoglobin A1C, or on the slide there it's HbA1c. This is a blood test that measures the amount of glucose that is attached to the hemoglobin, which is in your blood. The hemoglobin is what carries oxygen around your body, and sugar or glucose kind of sticks to some of your hemoglobin cells. And so it's a nice average because the hemoglobin lasts for about 2 to 3 months before it finally gets broken down by the body. So it's a good measure of average blood sugar over about a 2 to 3 month period. So this is really helpful to test and see if your average blood sugar, oh, sorry, I just said that. And the nice thing with this is you don't need to be fasting for this test. And the last one is called an oral glucose tolerance test. So it is, we're asking a person to drink a very sweet solution, and their blood sugar is monitored over a 2-hour period to kind of see how their blood sugar rises and falls. And it's helpful to see what people's glucose response is to that sugar. So here's what we're going to finish off with today, and what the rest of our two series of next Thursday and the following Thursday are going to focus on is managing diabetes. So some general strategies that a medical team is going to recommend is going to be diet and food choices. We're also going to be looking at our medications needed, so whether that's an oral medication or insulin. We're going to talk about physical activity. So how can we move the body? Stress management. So we're seeing more research around the role of stress in diabetes care and management. And for, kind of a quick summary, right? Like stress is not good, right? We know this for a lot of other body systems, but diabetes too. if we're able to manage our stress well, that can help in managing our diabetes. We also want to look at self-monitoring, right? Whether it's you yourself who have diabetes or your caregiver, if we can help that team, work together to monitor, whether that's doing finger sticks, whether that is monitoring food intake, maybe doing food logs to kind of help understand, okay, this is how much I'm eating. Here's what it does to my blood sugar. All of that self-check to be able to do as much as you can, right? Of course, with caregivers, there may be a little bit of additional support by that person with diabetes to help them monitor themselves. Also, having care team support. So that can be a mix of people from nurses to doctors to diabetes educators to dietitians to pharmacists. We want to have all these people on your team so that we can help manage your diabetes, whether you're the person with diabetes or the person that's helping care for your person with diabetes. And then, of course, education, right? We want to have, there's all sorts of support groups and educational classes, websites and webinars like this to help provide some more education and help people understand more about diabetes. All right, so caregivers, this is your turn. So what can we do for caregivers? So look at adaptive tools for your person with diabetes. So this could be alarms, even something simple like a phone alarm to say, all right, it's time to take a medication, or it's time to check, maybe a finger stick to check blood sugar. Maybe it's looking at a tool like a continuous glucose monitor that attaches to your person with diabetes, attaches to their body, so it can just regularly monitor blood sugar without having to do external finger checks. It may be helpful to create a simplified routine. So for someone with a disability who also has diabetes, it might be trying to limit the number of injections or types of times that medication needs to be taken. Maybe it is also using that blood glucose monitor to help simplify that testing. We can look at adaptive exercises to help promote self-care. So that would be just changing on the level of ability, right? So instead of maybe yoga, if that person has balance challenges or is maybe unstable on their feet, maybe we look at a chair yoga routine. So we can get that movement in the body and also being able to support their balance. Maybe it's something like a water exercise. So doing a water aerobics type of class where the water is supporting the body. So there's ways that we can adapt those exercises. Physical therapists hopefully are going to be a great resource in your care team for this. Maybe telehealth services are going to be beneficial. So it helps limit travel if you're able to turn on your computer or your smartphone and have a health appointment without having to do extra travel, or if it's a challenge to take your person with a disability for medical testing. Maybe this telehealth services might be one way to provide some supports. Or maybe the appointments are just super stressful and that person is really uncomfortable being in a medical center. So telehealth might be a way to provide medical services in the comfort of their home or another space that they are comfortable in. We can also look at simplified education, which we're going to talk about in future sessions. So I'm just going to preview that here, but we won't talk too much about it today. And then lastly is caregiver training and support. So we want this to be this webinar series, but other caregiver trainings and support tools to be of use to you. So that can be your own care, right? So making sure that you take time out to take care of yourself. So whether that's something that you enjoy, like walking or listening to music or going to your own, classes, you want to go make some pottery, maybe that's something that feels supportive to you. Finding things that while you're caring for yourself, not just your person with diabetes, but also for yourself. And I talked a little bit about hypoglycemia. So we really wanted to emphasize this because if someone with a disability is maybe not super aware of their body, it may be hard for them to identify a low. So hopefully learning about some of the signs and symptoms earlier will be helpful for any caregivers. And then here's how to treat those lows. So we do a 15-15-15 process. So we're going to eat or drink 15 grams of glucose. So that can be in a glucose tab that you can purchase. It can also be just any type of quick digesting carbohydrate. So juice, soda, raisin, something that will get sugar into the body pretty quick. Again, only 15 grams. We're not trying to get all the sugar into the body all at once. We just do that 15 grams. Then we set a timer. We're going to wait 15 minutes. And then we're going to retest that blood sugar, or if that person is still experiencing symptoms, we're going to repeat with another 15 grams of glucose. And we're going to wait 15 minutes. And we're going to kind of keep doing that until that person is feeling better and they are not low anymore, or otherwise out of their target range. And then some considerations of when do they eat next. So if it's just mealtime and they're like, okay, I normally eat maybe at 5:30 for dinner and it's 5 o'clock and I'm having a low, we go through this 15-15-15 process. And then if it's mealtime, they can still have that regular meal. If it's going to be more, if that next meal is not for maybe an hour or 2 hours, this is where we can bring in a balanced snack. So getting a little bit of carbs and fiber and protein and maybe some fat to hold that person over, make sure their blood sugar is still stable until they're able to get to that next meal. And so that'll be a little bit more of our session next week. So with that, it is time for questions.
All right, thank you, Caitlin. That was wonderful. Let's see. So in their chat box, there was one about hypoglycemia, best things to do or eat. So you kind of went over that. Do you want to add anything to that?
I think it's really practicing that awareness. So really learning, okay, this is what it feels like for me as the individual if I have diabetes, or if I'm a caregiver for diabetes, really being able to tune into, if I look at my person with diabetes and I notice these, maybe 5 things about them, I can feel confident that, oh no, they may be having a low. Let's, if you have the ability to test their blood sugar, do that. Otherwise, go make sure that you have a snack, or start that 15-15 process to get their blood sugar back higher, and then we can worry about other things like eating meals and snacks and hydrating and other things later.
Let's see. And then we have one about, which I believe well, I know we'll be covering this in detail next week, but can you explain the difference between simple and complex carbohydrates and the effects on blood glucose?
Yeah, so yes, so we will talk about this next week, but I'll just give a little preview. So simple carbohydrates or simple carbs are digested very quickly. And so these have benefits like helping raise blood sugar really quickly. This is also useful for if anyone has friends or family, or you yourself like to run or maybe do a marathon. People keep the hydrating gels, or the sugar gels with them as something to make sure that their blood sugar is staying high enough while they're running. So those quick digesting carbs raise that blood sugar really, really, really quickly. Those more complex carbohydrates, because of the type of foods they are, and I know Chris will talk about this next week, they slow down how quickly those carbs get into the blood, and that can be beneficial for preventing blood sugar swinging from whatever it normally is to really, really high. So I will let Chris talk about that next week in more detail.
Yes, so you must join us next week for that.
Yes.
So when blood sugar is not managed, it ruins nerves, and in return, we start losing functions, correct?
Right. So this is and I'll invite Chris if you want to jump into with some details, but this is kind of the part of diabetes, like it doesn't seem like a bad thing. Oh, I have a little extra sugar in my blood, but what we find is that uh, it's causing damage to different body systems, and one of the ways that it's damaging body systems is just like physical damage of there's more sugar in the blood, there's more what I called earlier in the session about like traffic, there's more traffic in the blood, and so just sugar is running into body systems and body cells, and that can sometimes cause damage. Chris, do you want to add anything more to that?
I think that's what makes controlling diabetes hard, is because sometimes we don't feel terrible. Some people with highs and lows blood sugars don't feel terrible, but unfortunately it is still harming us internally. And I had one educator explain it as, your blood is full of sugar, so it's stickier, meaning it's harder for it to get through those arteries and get to the places it needs to go. So I think that kind of puts a little bit more in perspective. But yeah, unfortunately, it can cause more long-term effects, and everyone's different, so it may affect some more than others.
Yeah. Yeah, I think that's a great highlight, Chris, about some people don't experience the same symptoms. And so um, you may have high blood sugar, but not really experience some of the symptoms we talk about. Same thing for low blood sugar. You may not experience some of those symptoms, but your blood sugar is still getting really low, and that it's still really, really dangerous for people. So that can make, as Chris said, that makes it really challenging to manage.
Sure. And especially if people aren't able to tell you how they are feeling exactly, it's really important to get to know those signs. Okay, we have another one. Let's see. Why is dementia considered by some physicians as a form of type 3 diabetes? Now, I'm going to say I have not heard of this. Um,
I have seen some headlines over the last year, but I have not read into them yet. Um, but I would so we know that there's guidelines around, how we diagnose and how we describe disease. And so yeah, we may get, so we know type 1 is described, this way with the pancreas not producing insulin. We know type 2 diabetes is described as having insulin, but just not being used well. So it's very possible that in the future we will have a type 3 diabetes that'll be described as a certain way. Maybe it will be related to brain health and dementia risk. So right now, I'd have to do a little bit more digging onto that topic, but yeah, it's very possible that in the future we may have, additional ways to describe diabetes related to a different, mechanism.
for sure. For the oral glucose test, do you have to be fasting?
I have never done it, but I'm assuming yes.
Yeah, I believe so, yes. Back to our questions. Can you ever get back to normal glucose and hemoglobin A1C with treatment so you can get off diabetic medications?
Yeah, there's a lot of, especially with pre-diabetes, if people are able to identify, okay, I'm pre-diabetic, and they're able to um, adjust food choices and physical activity and lifestyle and other lifestyle factors, they can definitely get back to that normal, glucose metabolism. And for those with type 1 or type 1, right? We're never going to get that back unless we are successful with like pancreatic transplants. So with that case, people with type 1 are always going to be on insulin medication. And then for folks with type 2, I would have to do a little bit of digging into, what those rates are. But I would imagine that there are people that are able to manage their blood sugar and get their blood sugar into a range that their doctor is, happy with, like, hey, we have good blood sugar management. This is going well. And we may try to be able either reducing medication, or they may be at the point where they could try being off medication entirely. Um, yeah, I think it's very individual to each person. So it's hard to give a blanket, yes, you can get off medication. It's always going to be very specific to that person, except
Right.
in type 1, where we're going to have insulin always.
Right. So yes, but you know that, weight loss, better diet can actually help improve symptoms. So back to the hypoglycemia. So how can a person avoid episodes of glycemia?
Yeah, so if you are on medication, so insulin or oral diabetes medications, and you're getting regular episodes of hypoglycemia or low blood sugar, it can be important to look at the dose. So making sure that maybe the dose is if it's in a good dosing size for you as an individual. So that's one thing we can check. One thing is also making sure that we're eating regularly. I know that a it's common for people to take their medication and not eat, which if the medication is already lowering your blood sugar and you're also not eating, that can make hypoglycemic episodes more frequent or just persistent. And also then diet is helpful, right? Someone previewed about, simple versus complex carbs, and Chris will talk about more about this next week, but having slower digesting types of carbohydrates can help, slow that rise and that fall of blood sugar. And for some people, that can be helpful in reducing their hypoglycemic symptoms.
So how many grams of sugar in a meal is okay? So that,
Okay. Chris, are you previewing this in your session?
yes. So yeah, that would probably be one we would touch on next week.
Yeah. Yeah, but so it's the grams of sugar, it's always that language, right? So we're going to talk about it as carbohydrates, but essentially it all ends up as sugar in the end, but people also talk about sugar as things like table sugar or honey. So Chris will talk more about like the specific amounts for that on our next session.
So this one here again, kind of about the long-term effects. Was it the extra sugar in the blood that causes blindness and poor circulation leading to amputation? What can people with diabetes do to avoid blindness and amputation?
Yeah, so having good blood sugar management, which is going to include all those things that we talked about with care, right? So it's food choices and moving the body as best you can, and stress management and weight management, um, and that will help improve the amount of sugar that stays in your blood. Hopefully, it will even lower it as you're using medication or other lifestyle changes. And yeah, it's that, as Chris talked about, right? It's a little thicker blood because of that added sugar, and so circulation is harder. It's right. The sugar's not moving as smoothly through all of your blood vessels, and so yeah, that can lead to kind of some. I'm simplifying here, but almost like a backup in the system, right? It's not moving that blood very well, and so that can lead to problems with that circulation and potential for amputation. So, good glucose management is going to be a really good way to help avoid that blindness or future amputation risk.
Well, if eating sugar does not cause diabetes, what can people do to avoid diabetes if they have family history? Just diet and exercise? Question mark.
Yeah, so if you have family history, hopefully you are getting screened on a regular basis. Hopefully you have access to a medical team so you can get, maybe once a year at the very least to just ensure that even if you have your mom or your dad have diabetes, we're just able to check and see how yours is doing. And then all those lifestyle factors are a big help in reducing that risk. Also, it would, also just give yourself some grace that if you do get diabetes and it's part of your family history, it's not the end of the story, right? You can still manage diabetes. You can still continue to enjoy your life and do things that you like, and you'll just have this as part of it. But you can still do amazing things with diabetes.
What is the effect of highly processed foods and blood glucose?
Ooh, interesting question. Okay, so um, let's talk about first on food processing. So um, really anything that we take from its original form and we do something to is processing. So me cutting an apple in half is technically processing. Me turning that apple into applesauce is processing. Me putting fresh green beans into a can and preserving that through canning, which just throwing out that we also offer education around food preservation. That's processing. So highly processed foods or ultra processed foods, those are kind of having a moment right now in global discussion. And so the processing of those foods can decrease nutrients. It often lowers the amounts of things like fiber, which I know Chris will talk about in next week's session, which helps manage blood sugar rises and falls. It can also tend to add a lot of salt, which has potential effect for cardiovascular health, which we talked about has um, concerns for cardiovascular disease and heart disease. Um, so depending on the type of processed food, it may cause blood sugar to rise more quickly. Um, it may also uh, be a source of extra fat or salt or other nutrients that just in general, right, are a little maybe harder on the body. But often we eat foods in combination with things. So we might be eating a bag of chips maybe as part of a snack, but maybe it's not the only thing that we're eating as part of a snack. So it's a great question and a very complex one. And I think just for the time we've got left, I'm going to leave it there. All right. Well, we are just at about 2 o'clock. Everyone did ask such great questions. So thanks everybody
Yes, thank you.
for joining us.
Thank you very much. Everyone have a great day.